Imagine sitting in a dentist chair and being told you need $4,000 worth of dental work. You reach for your Medicare card feeling confident. And the receptionist looks at you with an apologetic expression and says, "I am sorry. Medicare does not cover this. You are going to need to pay out of pocket." This exact scenario happens to millions of American seniors every single year. Because here is the truth that nobody tells you when you sign up for Medicare. Original Medicare, the standard government health insurance that covers hospital stays and doctor visits, provides almost zero coverage for dental care, almost zero coverage for vision care, and almost zero coverage for hearing aids and hearing exams. Three of the most common and most expensive health needs that seniors face in retirement, teeth, eyes, and ears, are almost completely uncovered by the Medicare that most people are relying on. In the next few minutes I am going to show you exactly what Medicare does and does not cover for dental, vision and hearing, why these gaps exist, and the specific options available to you right now to fill them. Tap the like button and stay with me. Let us start with dental coverage. Original Medicare Part A and Part B do not cover routine dental care. They do not cover dental exams. They do not cover teeth cleanings. They do not cover fillings. They do not cover extractions. They do not cover dentures. They do not cover dental x-rays. They do not cover root canals or crowns. Almost nothing dental is covered by Original Medicare. There is one very narrow exception. Medicare Part A will cover dental services that are medically necessary as part of another covered procedure. For example, if you need heart valve surgery and your surgeon requires a dental exam and clearance before operating, Medicare may cover that specific dental exam as part of the surgical preparation. But routine dental care, the kind every senior needs every single year, is not covered under any circumstances by Original Medicare. The financial impact of this gap is enormous. The American Dental Association notes that seniors without dental coverage face significant barriers to care, often relying on retirement savings to cover expenses. Consumer health data shows that out-of-pocket costs for routine dental care typically range from $1,000 to $2,000 per year. For seniors who require major work, implants, bridges, or full dentures, costs can escalate to $10,000 to $30,000. In 2026, this burden will only become more pressing. Now let us talk about vision coverage. Original Medicare does not cover routine eye exams for glasses or contact lenses. It does not cover the cost of eyeglasses or contact lenses themselves. It does not cover routine vision checkups. The only vision-related services that Original Medicare covers are medically necessary eye care, such as treatment for glaucoma, cataracts, macular degeneration, or diabetic eye disease. What this means practically is that if you simply need new glasses because your prescription has changed, Medicare pays nothing. If you want an annual eye exam to make sure your vision is healthy, Medicare pays nothing. The cost of a routine eye exam is typically between $100 and $200. A new pair of glasses with prescription lenses can cost $300 to $1,000 or more. Every year. All out of pocket. There is one important exception for vision as well. If you are diagnosed with diabetes, Medicare Part B does cover one diabetic eye exam per year performed by an eye doctor. And if you need cataract surgery, Medicare does cover that procedure and will also cover one pair of standard eyeglasses or contact lenses after the surgery. But beyond these specific medical situations, routine vision care is entirely your financial responsibility. Now let us talk about hearing, and this gap may be the most financially painful of the three. Original Medicare does not cover routine hearing exams. It does not cover hearing aids. It does not cover the batteries or maintenance for hearing aids. Nothing related to routine hearing care is covered by Original Medicare. Here is why this matters so much financially. Hearing aids are extraordinarily expensive. A single hearing aid for one ear typically costs between $1,000 and $4,000. Most seniors need two, one for each ear. That is $2,000 to $8,000 for a pair of hearing aids. And hearing aids typically need to be replaced every 3 to 5 years. Over a 10-year retirement that could mean spending $16,000 or more on hearing aids alone, none of it covered by Medicare. Hearing loss affects approximately 2/3 of Americans over the age of 70. It is one of the most common health conditions in retirement. And yet it is almost completely ignored by original Medicare coverage. The human cost of untreated hearing loss, isolation, depression, cognitive decline, makes this gap not just a financial problem but a serious health problem as well. Now let us talk about your options for filling these 3 significant gaps. The first and most popular option is Medicare Advantage. Most Medicare Advantage plans include some level of dental vision and hearing coverage as part of their bundled benefits. Coverage varies enormously between plans. Some offer basic cleanings and exams only, while others include major dental work allowances of $1,000 to $2,000 per year plus comprehensive vision and hearing benefits. The second option is standalone dental vision and hearing insurance plans. These are separate private insurance plans that cover specifically dental vision and hearing costs. You pay a monthly premium, typically between $30 and $60 per month, and the plan covers a portion of your dental vision and hearing costs throughout the year. These plans have annual maximums, so you need to understand exactly what they cover before enrolling. The third option, specifically for hearing aids, is a relatively new law that now allows hearing aids to be sold over the counter without a prescription for adults with mild to moderate hearing loss. This has dramatically reduced the cost of basic hearing aids to as little as $200 to $1,000 for a pair at major retailers. While over-the-counter hearing aids are not suitable for everyone, they represent a significant cost-saving option for seniors with milder hearing difficulties. Here is something that very few seniors know about. There are federally funded community health centers located in every state across America that provide dental vision and hearing services on a sliding scale fee basis. This means the amount you pay is based on your income. If your income is low enough, these services may cost you very little or even nothing at all. You can find a federally qualified health center near you by going to findahealthcenter.hrsa.gov. This is a free government website that shows every community health center in your area along with the services they provide. For seniors who cannot afford private dental vision or hearing coverage, this free resource could provide access to care that would otherwise be completely out of reach financially. Let us bring everything together. Original Medicare provides almost no coverage for dental care, routine vision care, or hearing aids and exams. The dental gap can cost seniors $1,000 to $2,000 or more per year. The vision gap means paying out of pocket for all routine eye exams and eyeglasses. The hearing gap can cost $8,000 or more for a pair of quality hearing aids. Your options to fill these gaps are Medicare Advantage plans with built-in dental vision and hearing benefits, standalone dental vision and hearing insurance, over-the-counter hearing aids for mild to moderate loss, and federally funded community health centers that provide care on a sliding scale fee. If this video helped you understand these coverage gaps, please give it a thumbs up right now and share it with a family member who is approaching Medicare age. Knowing about these gaps before you need dental work or hearing aids could save them thousands of dollars in preparation. Subscribe to Medicare Made Simple, because tomorrow we are covering Medicare benefits specifically for veterans, and if you or someone you love served in the military, there are additional benefits available through the VA that most veterans are not combining correctly with their Medicare. That video could be worth thousands of dollars to any veteran watching. I will see you in the next one. This video is for informational purposes only. It does not constitute medical, legal, or financial advice. Medicare coverage rules change annually. Always verify current information at medicare.gov or speak with a licensed Medicare advisor for your personal situation.